evening. Good evening. It is midnight where I am, and I am here to help you get over the hump of studying for NCLEX. Maybe you have been attempting to take this exam for months, dare I say, even years for some people, but now you are ready to pass the NCLEX, get your nursing license, and boom, go into the professional world of nursing. This is possible. This is what we do every Monday at 12 p.m. Eastern Standard Time. Hi, my name is Professor Regina. I love to see you succeed in nursing. And so today we're going to do that by talking about a subject that many of you may question. When you see it in your quick facts, you may have said, Professor Regina, why did you put Wilson's disease in this book? What is it doing here? And so we're going to get into exactly why this subject is so important. But before we get into this, here's the question that I want you to think about and the action that I want you to take. And it is simply why the time is now to pass NCLEX. This is what I need to say. You know, I'm here in the Philippines and I am literally seeing nurses upon nurses upon nurses who are excited about the possibility of getting a USRN. And so it made me think of all of the people who are back in the United States who are sitting in the perfect situation to take NCLEX and pass it, but have excuses on why they're not getting it done. And so I want to remind you why right now is the best time for you to be taking this test. And so my goal is to challenge you to just think about it. Think about why now is the time. And let's stop acting like we have tomorrow promised to us, or that there's some perfect situation that's going to come and say, okay, now it's time for you to get into it. But like, what about this? There is a cost to you waiting to take NCLEX. Every day that you delay your taking the test, you're preparing for the test, you're studying quick facts, every day that you delay, you know what you're missing out on? So much. I can start by just saying the income, right? Because most of us don't understand that when we are not working as a nurse, then we are not making nurse money. And so this can be a year, $60,000, $70,000 that we just miss out on because we're not taking the test. We're delaying. All right. And what I noticed too is that there's another price that you pay, and that is the longer you wait, the more your anxiety grows, the less confident you are, because you've been in this holding pattern where you've allowed anxiety to start this big, but over time it grows, right? So when I meet people and they say, hey, I haven't taken NCLEX in 5 years, I know that their anxiety, their burnout is very high. Okay. And also, you know, you miss out on just opportunities. Doors close up. Applications expire. Money is wasted. Every day you delay, you end up paying more than you expected for this process. This is the cost of waiting. We're already in the 4th month of 2025. Can you believe that? The second thing is just this. I'm all about positive thinking. I'm a confidence, when it comes to this, I'm your confidence, I'm your cheerleader. Most of you, honestly, you're more ready than you think you are. And hi there, come on in. This is Monday motivation. You're really ready, honestly. You don't need more time. Most of you don't need more time. You need more focus. Okay. You need to be intentional. I'm speaking to somebody, right? I might be stepping on somebody else's toes, but I'm speaking to somebody. You need to be more intentional about what you're doing when it comes to NCLEX, because you are gifted in nursing. Anyone who passes a curriculum You have this gift, you have this ministry. You need to stop doubting yourself and just walk in the victory. Walk in your ability to be able to sit down and answer clinical reasoning questions based off of what you've been doing. Okay. And like I said, I'm just so I'm so motivated by the stories that I'm hearing of the nurses here in the Philippines that are just like, you know what? I know I may not be in the country. I know I have to pass an English exam. You know, I know I didn't have to look for an employer. Like they have all these things that they're just like chopping down because they're like, nothing's going to stop me. Nothing's going to stop me. And some of us are already in the right location. We have the right credentials. We have the right language. And we are making excuses why we can't get it done. We are still struggling with the same hangups. I failed. You know, I failed NCLEX 2 times. I can't do this. Meanwhile, you got another nurse that's like, by any means necessary, I have to do this. What I am realizing is that when you understand what's on the other side, you disconnect from your past of anxiety, failure, whatever, and you really push to get to that other side, right? Passing NCLEX is going to unlock the promise, that promise for financial freedom that I talk about. And it's not so much the financials, it very is the freedom that does it for me. Being able to work when I want to, being able to work for how long I want to, right? Pass NCLEX, get to that. If you're an international nurse, you passing NCLEX, that is going to open you up for visa sponsorship, global opportunities, companies saying, oh, what's your background? What do you want to do? Right? Having your USRN allows you to be able to have those conversations. If you don't have your USRN, you're coming in a very low position. And then, you know, for me, the big one, being able to elevate and support your family. Your nursing license is not just about you. There are people who are depending on you to get this done in their lifetime. There are people that their future is on hold because you refuse to do what you're supposed to do. And it could be young or old. It could be your children. They can't get access to the schools they're supposed to be in. They're not taking, you know, the trips. You know, your parents may be working very hard still. You know, your nursing license is to serve yourself and your community around you. Okay. And those people are waiting on you to take it serious. I have seen over my time just a transformation that happens when people stop doubting and just walk in the way. Just open up the door that I tell you to open. And behind that door is the success. It's the family. It's the new location. It's the nursing license. You know, it is the opportunity that you have now that, hey, you can go anywhere. You can go anywhere. Never, when I first got my, you know, my nursing license, did I think I would be in Jamaica teaching nursing? Did I think I would be in the Philippines? Right now I'm in Cebu and I'm in the Philippines teaching nursing, right? Never did I imagine. So in your, you know, what is your wildest dreams? Where do you see yourself doing? What do you see your family doing? Let that be your motivation. But also I want to do this. I want to challenge you with a refocus challenge. 5 steps of the refocus challenge. And these are things that I want you to commit to this week. This is Monday motivation. This is a new week. Here are 5 pillars of the refocus challenge. This is what I want you to do every single day. The first is pray first. This endeavor to become something that you are currently not requires you to address a full person, okay? Not just physical, not just mental, but spiritual. And so I just want you to start every study session, because of course, the Refocus Challenge is about you studying. I want you to start every study session with a short prayer, just asking for wisdom, focus, and peace on this journey. And it simply can be this: Lord, help me to retain what I learned today and use it to help others. Okay? That is such a good mentality that you are serving during this process. And so you need God's grace in order to serve others. That's the first thing I want you to do. Every time you study, start it with prayer. The second thing is I want you to read quick facts every day. Read this book, 5 pages or 15 minutes every single day. Don't skip it. And what I want you to do is literally just highlight unfamiliar terms, because there's so much in quick facts that because it's so simple, you may miss things. And so read it with intentionality. I'm critically thinking through this book. Okay, that's the second thing. This is the Refocus Challenge for this week. Third thing, watch one ReMar video a day. Choose a ReMar video. Okay, if you're in the V2, then you have your daily calendar. You're going to be following that video. Okay, especially if you've been slacking off. Get in V2, start it. If you don't have V2, you can get V2 for free. You literally can do this Refocus Challenge with the free trial. All you have to do right down here, go to remarnurse.com/free. Make that part of your challenge. You're going to watch one video from the V2 or from the trial. Okay. If you don't want to do that, you can look at YouTube. You can look at the Winning Wednesdays, Monday Motivations. And then I want you to write down 3 things that you're taking away from the video. Okay. Fourth thing, practice questions. Okay. No cramming, just consistency. I have 10 questions here. You can do 10 questions. Not 100, not 50, just do 10. All right. You can use your V2 workbook and then go into the question bank for the topics. Just focus on what the rationale say, right? Understanding. And then finally, you got to speak positivity into the atmosphere. So declare it out loud. Speak over your study journey every morning. I will pass NCLEX. You guys know I can, I will, I must. I love that. I will pass NCLEX. I am focused. I am favored. God has anointed me for this time. I could have been born anytime. I could have been born with the Egyptians. I could have been born with, I could have been born during the times of slavery. I could have been born during the civil rights movement. But no, the Lord has anointed me for this time, for a purpose. I am favored right now. I am prepared. I am ready. I need you to speak to that. That's your future. That's what I want you to wake up and do. I want you to wake up and connect to your future in the morning. Okay? All right. Now let's talk about Wilson's disease. Because part of the focus is looking at a topic from quick facts, right? And going into it. Now, Wilson's disease is something that you may be asking, why did you put this on the exam? Why did you put this in quick facts, I should say? The reason is because Wilson's disease is it's a medical emergency if it's not recognized early. Okay. With NCLEX, you have to be able to interpret, and this is what I talked about with my international nurses yesterday, physical assessment. You have to be able to interpret when your patient comes in to be able to make the connection as, oh, if I don't get this right, they're going to be brain dead. Or, oh, if I don't get this right, they're going to lose their airway. And that's based on physical assessment. So Wilson's is one of those things. So you guys know I like to present the information to you in various ways. When we think about Wilson's disease, and this is coming from Quick Facts, page 89. Just want to make sure quote myself right. Wilson's disease, yes. Page 89 in Quick Facts. And you can see this topic is very short compared to others. Wilson's disease is very short. However, in here, if you miss this, I'm disappointed because the major facts of this have to be known. So if I put this picture up, who is most likely to have Wilson's disease? Is it the mom or is it the daughter? Who's our patient here? Come on, this is the Refocus. We're talking about Wilson's disease, page 89. Who is most likely to have Wilson's disease, mom or daughter? Yep, and if you have Quick Facts, is right there, and I'll be reading this to you guys. Okay. Absolutely going to be daughter. Going to be daughter. I say here, what is Wilson's disease? It's a genetic defect that causes copper buildup in the body. So we are talking about pediatric patients. We're talking about adolescents, okay? Adolescents. And that's something you got to catch in Quick Facts. So why is it on here? Wilson's disease is, whenever we talk about a genetic disorder, is this something that's going to be common or is it something that's probably going to be rare? What do we say? For genetic disorders. And, with genetic disorders, it's going to be, yes, rare. It's going to be pretty rare. However, NCLEX likes to spotlight the dangerous ones. And what makes this condition dangerous? You're going to have an adolescent patient, and they are going to start behaving weird. How do I say that? They're going to start to have personality changes. Now, normally, when you are a teenager, do you begin to have personality changes amongst your family? Would your mother say, oh my goodness, this child of mine, when they hit 13, some people, when they hit 11, when they hit 13, when they hit 14, they change, their personality changed so badly. Okay. That would be common. However, what we need to understand about Wilson's disease is that not only are we going to see a personality change in Wilson's disease, but we are also going to see organ malfunction. We're going to see organ malfunction. And one of the things that we have to realize is that this is a lifelong, long-term condition. And so that means that as nurses, we have to teach the patient about medications. We have to teach a patient about lifestyle. And if this is not caught early on, we know that our patient is going to have some long-term issues. Okay. They're going to have some toxicity issues because they're having copper building up into their system. How important is Wilson's disease? So important. So important for our patients. When we say it, it is a rare, autosomal recessive genetic disorder causing hepatolenticular degeneration. I put this word in here purposely because Quick Facts describes it. Hepatolenticular is what? Now, I know you might recognize hepato, right? Lenticular is the other organ that I tell you that Wilson's disease affects. So open up your Quick Facts. Tell me what those two organs are. Okay. And it's because there is a buildup of copper, right? So it is the liver and the brain, hepatolenticular. This condition, if not remediated, will cause brain damage and liver damage. And also I could put kidneys there as well too, because the kidneys will be looped into it. Age of onset, young person, below 40 years. And what you will see is this characteristic circle of copper around the eyes, Kaiser-Fleischer ring. Okay. This is why we have to know this, because if your patient doesn't present to you where you can recognize it, they're going to go home diagnosed with something else. And if they are not in a, in a hospital system where the nurses are advocating, they could be sent home and not returned back to the hospital until it's too late, until it's too late. So we want to take care of our patients. We want to take care of our patients. Knowledgeable nurses do that. Now, also, if you have quick facts and you're reading it, I introduce a new medication that you probably didn't know here, but you do need to know for Wilson's disease, and it is penicillamine. Penicillamine is to help this patient to get rid of the copper metal toxicity. I say here, this is not penicillin at all. Do not think that it is penicillin. Okay. Note the difference here. So when I talk about studying for NCLEX, when I talk about quick facts as a staple, everything in this book has to be memorized. Every single thing. If you memorize the things in here, you won't be taken by surprise, and you'll be able to critically think. You'll be able to critically think. When I first asked you who would be more likely to have Wilson's disease between a mother and a daughter, everybody who picked mother skipped over the fact that quick facts tells you this is a genetic disorder. And so we typically see the presentations of genetic disorders early on. Okay. And that's just being able to critically think, which is something you have to do. So use this week to refocus and reset. I'm not going to do any questions or anything like that about Wilson's disease. We went over the majors of it today together. Okay. I do, as we go into the next phase, I just want to remind you that the system is in place for a reason. One of the things that makes the V2 program unique is that you are getting the physical books that you need to engage with the material. Information is not helpful to you if you do not apply yourself to it. You can purchase every book in a library, but if you don't connect with it and you don't put your heart into it, then that transformation that needs to happen won't happen for you. And sadly, people don't pass NCLEX and they're totally surprised why they didn't pass NCLEX, right? Or people purchase materials, books and videos and things like that, and they never use them. Never use them. So I'm challenging you, use the books in V2. They are unique. They are there to improve your comprehension. Do it. It's a simple watch the videos, read, answer. Okay. You can do that. Now, my motivation is simple as quick. I'm in and out of here today, guys. Have a class to teach later after that. And then I have to travel to another city. I am doing the work of making myself accountable to you when you say you want to pass NCLEX. So the classes that we're putting on are free. We're just asking people to show up if they're serious. And so this has been my encouragement to myself, is that God's support isn't temporary. And so I believe that when you are a young child, you have experiences, you have a calling on your life. And I believe that some of us get that calling revealed to us when we are younger. And the Lord opens up doors. He opens up doors carved of stone. Just like they had to roll away the stone in Jesus' tomb so the women could get in. Jesus had to roll away some stones so that you could get in. Okay. And as we go through this process, as we grow older, we still have to be faithful to understand that the Lord's support has not been temporary. Isaiah 46:4 says, even to your old age and gray hairs, I am He. I am He who will sustain you. I have made you and I will carry you. I will sustain you and I will rescue you. And it is a great promise to us who are needing help. It is a great promise to us who are quick to confess, I cannot do this in my own power. Lord, there is nothing in me that can produce the type of fruit that I am seeing in my life. It is only because of you and you sustaining me in this endeavor, right? And so that's something that I'm recognizing in my life. And I hope that you see that too, that since you were a child, the Lord has been with you. And even now, as you grow older, it is still He who is sustaining you. Oh, what a wonderful Savior. What a wonderful Redeemer. The Monday motivation is God's support isn't temporary. It lasts from birth to old age. And life comes with struggles, but God's promises, they sustain us. He doesn't take us out of the storm. He takes us through the storm. He takes us through it. And that helps to increase our faith, which is what we need in this life experience. He is looking for those who will have faith. Will He find them in the earth? And no matter what dangers, mistakes, or hardships we face, God promises to rescue us. You have survived 100% of your bad days because you are here. You are still here, being able to be a living testimony to what God can do. And so as we refocus this week, let's start every study session with prayer, thanking God for His faithfulness, thanking God that His mercies are new every morning, every morning. I'm so grateful for the opportunity to be able to be with you today. As I prepare for my class, I know I will meet many nurses who are striving to go into the ministry just like you are. And if we can keep each other in prayer and we can find ways to serve right now as we wait to be served, we will go far. We will go far. All right, everyone. I love you all. We will meet again on Wednesday by God's grace. If you are in Cebu, I will see you in just a few hours. We have class. So God bless you. God bless you all. Bye-bye.